Hello, everybody. Excuse me. Welcome back. Hope everybody enjoyed the breakout session and the wonderful, session and information that we heard this morning. This is a special time in the program every year where we honor those who are in the community who have really championed equity. And the Delaware Healthy Mother Infant Consortium looks to recognize both a community member and community members and community organizations who've really led the charge in Delaware for their work in health equity. I know Dr. Rattay is here and waiting. And while we're queuing up Dr. Rattay, I just want to go over some of the great data and news that we heard this morning. For those of you who weren't able to join in at 8:30 and hear from the Lieutenant Governor, and that we recently heard Delaware's 2020 infant mortality rate and statistics, and our infant mortality rate is down to 5.5 per thousand live births. When we started our program, it was about 9.3 per thousand live births. And so that is really a tremendous reduction. And we're only now just a tick above the national average of 5.4 per thousand live births. So hopefully next year, the year after, we'll be able to report our success in really driving it down further and be a shining example throughout the country of how you continue to do this work at a state level. So with that, I'd like to turn to Dr. Rattay. Dr. Karyl Rattay is a fellow pediatrician. She is the long-standing director of the Division of Public Health. I believe we recognized her recently for being the longest-standing public health official in the country, or state director of public health in the country, which is quite an accomplishment. And really honored to have worked with Dr. Rattay over the years, and thank you for your guidance, for your advocacy, and your important role in improving maternal child health outcomes in the state of Delaware. So, Dr. Rattay, I'll turn it over to you for the Kitty Esterly Healthcare Awards. I see that some of the recipients might not be on, so go ahead, start, and we'll if they're not ready, we'll go over some other things from this morning. So take it from there, Dr. Rattay. Great to see you and great to have you.
Thank you so much, Dr. Paul. It is so great to be here. I have while I've been focused on COVID, I've really missed this work, working closely with the DHMIC, with you, Susan, Tiffany, Leah. Today has just been an amazing day so far. All of you and the DHMIC are such a gift to our state. And the incredible results that the Lieutenant Governor and you have just mentioned are the results of persistent hard work and leadership from you and the other DHMIC members. So I'm just so grateful, as we all are. And this summit itself is such a treat. It's been such an amazing day so far. Dr. Williams has just been so inspiring. Jenny Joseph, our amazing Delaware leaders in the panels, as well as the breakouts. I am listening. I am so inspired and just so grateful. As you and the Lieutenant Governor said, we have made great progress, and that is so worth celebrating. But it is critical that we push even harder towards our mission and to decrease the unacceptable disparities gap. As Representative Minor Brown said this morning, we need to get even louder to empower a stronger community for everyone. The state of Delaware remains committed to addressing persistent and dire health disparities and improving the social determinants of health. While our infant mortality is improving, and I don't have the most recent data, but the data that I have and really has stubbornly stayed the same, shows that Black babies in Delaware are 3 times more likely to die before their first birthday compared to white babies, and Black women, while making up 1 out of every 4 women giving birth in Delaware, accounted for 50% of mothers who died. So again, this theme today is so powerful. Listen, connect, and inspire change. And it is critical to decrease these gaps. Additionally, alignment of efforts and resources is also key, and leveraging our resources and continuous investment is critical so that our girls and women receive necessary support long before, during, and after their pregnancies. And while it has been a tough and crazy time for all of us, I am just so appreciative of the ways that you all have continued to move the DHMIC mission forward during this COVID pandemic. And we keep moving forward, and we will overcome the tough challenges that lie ahead. Know that just as we've supported the DHMIC from the start, we at DPH stand with you now, and we are eager to use every resource within our reach to support your success. I get the best, I think, the best job of the day, and I'm just so honored to be asked to present this year's Kitty Esterly Health Equity Champion Awards. Uh, Dr. Esterly, and I did not know her as well as some of you, but she just was such an incredible pioneer who in many ways paved the way for the establishment and ongoing work of the DHMIC. Long before inclusion and equity became part of the common language, Dr. Esterly was a visionary, becoming a pediatrician where there were very few women physicians at all. And she was one of the first pediatricians in the country to specialize in neonatal care. Through a career spanning 3 generations and empowering better lives for countless infants, Dr. Esterly was a champion of what we refer to today as health equity. She gave a voice to some of the most vulnerable populations, overlooked for centuries and too afraid to speak for themselves, so they could seek the same quality healthcare as everyone else. Dr. Esterly opened doors to give these populations better care. She gave them knowledge and hope. And in doing all of this, Dr. Esterly also gave us inspiration to carry out and grow the DHMIC mission. She was an original advocate of health equity for mothers and infants. The bridges we build to reach at-risk populations today are influenced by Dr. Esterly's courage to speak out and be a champion for equal care for all people: white, Black, brown, rich, poor, middle class, male, female, gender neutral, people of every shape, size, and creed. This is the woman we celebrate today and to whom our honorees have had to measure up. The nominees were selected for charting their own path in ways that tremendously impacted women, children, and families. Thank you for your exceptional work and for being exemplary role models. So I will start with our 2022 Kitty Esterly MD Health Equity Champion Organization Award. And this year, 2 organizations tied for the award. Our review panel determined that both should be awarded. And the winners are Westside Family Healthcare and Planned Parenthood of Delaware. So I'm going to start with Westside Family Healthcare, which provides integrated primary medical, oral health, and behavioral health services to more than 28,000 Delawareans. Westside plays a vital role in meeting the needs of underserved families and individuals regardless of their income. Their care model works to support patient care with a team-based approach, with patients as partners in their care. To address transportation barriers to care, Westside Health Centers are located along bus routes. They offer bus passes and at times reimbursement for Lyft and Uber to appointments. To address other social determinants of health, Westside offers wraparound services as part of their care model. Their social service coordinators and community health workers partner with patients to ensure they have access to affordable housing, job placement, healthy food, clothing, and other necessities. Additionally, since the COVID-19 pandemic, Westside raised funding through federal and private grants to launch a remote blood pressure monitoring program for their prenatal patients. Under this program, Their most at-risk moms can monitor their blood pressure at home, reducing unnecessary visits to the health center that could increase risk of exposure. They have prioritized postpartum and infant care by providing critical wraparound supports to support families who faced unemployment and other unforeseen hardships during the pandemic. They raised private and state funds to deliver boxes of diapers, pack and plays, car seats, sleep sacks, infant hygiene items, breastfeeding pumps, and breastfeeding supplies to support moms most in need. And when the community spread of COVID was significant among Delaware poultry workers and testing capacity was needed, Westside sent more than 25 employees to our poultry plants to support testing and services needed by quarantined individuals. They incorporated on-site testing at their health center, offering rapid testing for patients in need. They also provided case management to support patients who tested positive, which ensured their patients had the resources needed to help keep them healthy and their families safe. So grateful for all of their efforts, and congratulations to our colleagues at Westside. And so I am not sure who from Westside is on. Oh, hi, we have Megan Werner. Megan, welcome. Congratulations. And the floor is yours to make a few comments.
Thank you very much, Dr. Rattay. My name is Megan Werner. I am a family physician and the Associate Medical Director of Population Health and Quality at Westside Family Healthcare. On behalf of the entire Westside community, we would like to thank the Delaware Healthy Mother and Infant Consortium for recognizing our organization with this award. Dr. Esterly was a tireless champion for the well-being of all women and children and an inspiration to so many in our communities. It is truly an honor to be recognized as an advocate for health equity through this award given in her name. At Westside, advancing health equity to improve the health of our patients and our communities is an integral part of our work every day. We believe that everybody deserves to have access to high-quality healthcare, regardless of their income, language, race, ethnicity, or gender identity. Our organization strives to provide this access through individual healthcare services delivered by our caring medical, dental, and behavioral health providers, as well as through our community-based programs and services. This includes providing services essential to the well-being of mothers and children, such as prenatal care and child visits. Although we know it can be challenging for some families to engage in this care under any circumstances, the COVID-19 pandemic introduced a new set of obstacles for healthcare providers and patients to manage. Fortunately, through focused outreach by our team and the almost overnight adoption of a prenatal schedule that incorporated telehealth in 2021 compared to pre-pandemic levels, we were able to maintain or improve several measures impacting the health of our pregnant and pediatric patients, including early access to prenatal care and complete on-time childhood immunizations. The COVID-19 pandemic laid bare many of the inequities facing underserved populations in Delaware and throughout the country, as we saw people of color and those with lower incomes bear a disproportionate burden of this disease. In the early days, we saw how difficult it was for individuals and families to know what to do if someone in their household tested positive for COVID-19. As vaccines became available, getting vaccines to underserved communities, and especially those individuals who primarily spoke languages other than English, was also a challenge. To address these needs and to ensure that all Delawareans had access to these critical services, Westside partnered with organizations across the state to provide education on COVID test results in language that our families understood, including practical information about managing isolation and quarantine in a variety of living arrangements. Westside also worked to make vaccines accessible to underserved communities, knowing that increasing vaccination rates in the hardest hit communities is an important way to decrease the inequity associated with this disease. Starting in the spring of 2021, Westside has been holding walk-up vaccine clinics at each of our permanent sites, as well as pop-up vaccine clinics for agricultural workers using our mobile health unit. Through these vaccine clinics, we have provided over 27,000 doses of COVID-19 vaccines to any interested, eligible individual. Our model has been especially useful for families because we have been able to offer pediatric and adult vaccines simultaneously. Streamlining the COVID-19 vaccination process by allowing parents, grandparents, and children to be vaccinated together in a convenient location with accessible hours, and importantly, with trained health professionals available to answer their vaccine-related questions, has contributed to increasing the vaccination rate among underserved populations and slowing the spread of COVID-19 in their communities. While we hope that the COVID-19 pandemic will soon come under control, we know that the health inequities that our population faces persist, and there's still much work to do. We're grateful for the opportunity to work to make better health accessible for everyone, and we look forward to continuing to take steps with our partners and our communities to make health equity a reality for all Delawareans. Thank you very much.
Thank you so much, Dr. Warner, to you and to all of Westside for the tremendous work that you do. And again, congratulations.
Thank you.
So our next award to a health equity organization is to Planned Parenthood. Planned Parenthood of Delaware has been just such a tremendous partner. Planned Parenthood of Delaware strives to improve health outcomes across the state, including increasing access to prenatal care and reducing rates of unintended pregnancy and sexually transmitted infections. Their new clinic in Seaford provides access to essential reproductive health care services for a previously underserved geographic region. In addition, they provide evidence-based, shame-free sex education to thousands of Delawareans each year, equipping them with the information and skills they need to protect their health. Health equity means that all people can fairly and justly access high-quality health care when they need it. That includes removing obstacles to ensure that traditionally marginalized groups can access affordable, high-quality health care. Planned Parenthood offers evening appointment times, telehealth services, and sliding scale fees. They apply an equity lens to policies and procedures, provide health equity training for staff, and support legislation that increases access to health care for all. Planned Parenthood's mission can be summed up in a few words: care no matter what. They tackle long-standing issues like discrimination and systemic racism. Through their work and values, Planned Parenthood of Delaware demonstrates that they stand for progress, equity, and justice. Health equity is one of the single most important aspects of their work. With compassionate care, Planned Parenthood of Delaware clinicians ensure that their patients get the services they need, that patients' wishes are addressed, and that patient concerns are at the center of every healthcare visit. They work hard to ensure that the community can access quality, affordable healthcare and the information they need to protect their health. Through their patient care and education services, as well as their advocacy work, they meet people where they are to provide the care and information they deserve. Diversity, equity, and inclusion surround almost everything they do, and as they strive to help those most in need. Planned Parenthood of Delaware also works with a network of like-minded nonprofit and healthcare organizations in Delaware to provide essential patient care, referrals, and education. Congratulations, Planned Parenthood of Delaware. And Dr. Paul?
Thank you. It looks like nobody is here at the time from Planned Parenthood of Delaware to accept the award. We just got word that Ruth Barnaby is in general session making comments. So I echo the words of Dr. Rattay. Thank you. We will honor Planned Parenthood maybe in person at the next DHMIC meeting. We really appreciate their work, and we will accept the award on their behalf. So thank you.
Thank you, Dr. Paul. So finally, it's really a great honor to announce our individual 2022 Kitty Esterly MD Health Equity Champion. And this should come as no surprise to anyone that the individual award for 2022 goes to State Representative Melissa Minor-Brown. Representative Minor-Brown is a staunch advocate for vulnerable women and children in Delaware. Her policy agenda reflects her passion to address disparities for Blacks and Indigenous people of color. Representative Minor Brown removes barriers and galvanizes stakeholders in various sectors, such as legislating for an extended postpartum period for Medicaid coverage and creating space for doulas as an integral part of the healthcare delivery team. She is willing to do the things others will not. She is brave, authentic, and transparent. These are essential attributes when working to promote equity and dismantle structural racism. Representative Minor Brown works tirelessly in many things, but on 2 DHMIC committees. She leads the doula task force and works on the social determinants of health committee. She co-chairs that committee, as she mentioned, with Rita Landgraf, to address issues such as housing for homeless and pregnant women. Representative Minor Brown is the consummate servant leader. She diminishes barriers that contribute to health disparities. Ask why she's so passionate about righting wrongs and creating a path towards health equity for people who are oftentimes forgotten. She answered, because I can, and God provided me with a platform to try and make a difference in the lives of others. And that's what I'm here to do. We are so fortunate to have your leadership in Delaware and on the DHMIC. Congratulations, Representative Minor Brown.
Dr. Rattay, DHMIC, thank you so much. I actually was really surprised when I heard that I was receiving this award. I actually sent an email and said, "Are you sure?" And they confirmed that I was receiving this award. But I just want to say thank you so much. You know, when you're embedded in this work and you're dedicated to this work and seeing favorable outcomes, you never really think about receiving recognition. My work is driven by real life experiences, being a teen mom, relying on Medicaid and state assistance. And I just remember those days walking into social services and feeling like I had to prove myself and who I was and the possibilities that I was going to create for my future. But those spaces were never really welcoming. They were never, ever empowering. And so that drive started back then when I felt like I needed to prove everybody wrong who did not think, or who showed me that I really could not amount to much at all. So having experienced that, and then the unfavorable experiences during pregnancy and childbirth and postpartum, I now use those experiences to lead my work. And so no other person has to go through that or has to experience what I've experienced. And my goal is to continue this work in my role as a nurse, as a mom, as a Black woman, as a legislator, as a community advocate, and also in my role working in higher education. And it's just most fulfilling for me to just see those gaps close, to see those disparities one day disappear. And I'm going to continue this work until all women feel valued and they feel empowered in this space, in the healthcare space, in the social service space. So I'm going to be here for a while. And I just want to say thank you for recognizing the work that I've been doing. Thank you.
We are just so grateful to you for your leadership and all of the work that you do. Congratulations to you, Representative Minor Brown, and congratulations to all the award recipients for your thoughtful work and for making Delaware a healthier place to live. And thank you to all of you for participating today and for carrying out the DHMIC mission. I am confident that the consortium will continue to push hard to achieve the outcomes we envision for lowering mortality rates and eliminating the disparities and empowering healthier futures for all. And with that, back to you, Dr. Paul.
Thank you. So congratulations to Westside. Congratulations to Planned Parenthood. It does look like Ruth Little Barnaby was present, but not on our internal channel here, kind of in the general meeting. So congratulations once again to those two organizations. Congratulations to Representative Melissa Minor Brown. So happy to recognize the work that's been done by all of you to improve health equity. And I just want to say that there is a committee on the DHMIC that looks at all applications, considers them very carefully. And so we look forward to hearing your nominations next year and recognizing all of the tremendous work that's done in the community. And I want to go back and recognize Karyl Rattay, not for her work with the DHMIC over the years, which has been just outstanding, but for her work with COVID-19. That has just been a full-time job. And for those of us who work in healthcare, it's become all-consuming at times. It's just really nice to work on other things. But she is kind of at the tip of the spear at the state, and it's been, I'm guessing, kind of thankless, but we all appreciate you for keeping us safe and keeping us healthy, and for all the work you've done on behalf of public health in the state of Delaware. Greatly appreciated, and hopefully this is the last and only pandemic we will all live through. So with that, we're going to go back to breakout sessions from 12:30 to 1 o'clock. Please take time to visit the Delaware Community Voices and the breakout sessions. We've heard in the chat about things like maternal early warning signs, about women's emotional wellness, about doulas. This is your time to learn more about those activities. Again, from 12:30 to 1. It should be you should be able to access on the right-hand side of the event display under community breakouts. We'll then have a break at 1 o'clock, at which time I think we'll hear from Rio Holiday, the graphic designer. Stay tuned to the end of the day. I can't wait to see what she comes up with from all of our comments and all of the thoughts throughout the conference today. And then at 1:15, we'll be back for our third and final keynote address. So thank you. Enjoy the breakout sessions over the next 30 minutes.